first, you're going to find two landmarks that are very important right off the bat. All right? We need to find C7 and L5. All right? So C7, we remember we talked about before how to find that. So the first thing I'm going to do is find C7. All right? So I'm going to have him flex, extend back up. I'm going to keep that point. I'm going to put a little tiny dot right there. And guys, before you do this in clinic or ever did, or if you're out on a clinic with a CI, excellent, this is appropriate, this is okay with the population you're with, okay? Next thing you're going to do is find L5, right? So again, whichever way you want to do it, if you want to find iliac crest and realize you're at that L4, L5 junction, which is what I usually like to do, all right? Come right to the middle and then drop to the first body below. All right, so now I have my two marks. All right, so what I'm going to do is I'm going to get a measurement of these two marks. He's been using centimeters like that, right? In centimeters, preferably. Only in centimeters? How's that sound? All right, so for him, our measurement right here, following that spine, I'm getting 39. Okay? I'm sorry, I'm lying to you. I'm getting 46. Very close measurement, guys. I was only off by a drop. Right? So somebody write down 46 and be so lovely for me.
Gotcha.
I'm going to move this stool from in front of him. And I'm going to ask him to keep his legs straight and try to reach down and try to touch the floor. I'm going to remeasure now. You comfortable? And now I'm getting 56. All right. Stand back up. All right. So what is my excursion?
10 centimeters.
56. Yeah, 56 minus 46 would be the excursion. All right. So 10 centimeters is my excursion. All right. So that's my flexion excursion. Okay. Same exact norm. We already have a number of 46. Okay. So now we're going to go for extension. Bill, you fine with them putting their hands like this for extension?
Okay.
You fine with them putting their hands like this for extension?
Yeah, that's good.
All right, so just push your hands on your side. Good. And what does it have them extend over? All right. Important thing for this. Okay, look at me, guys. When you do that extension, this is not what I'm looking for. All right, and you will see plenty of people, patients, do that. All right, so make sure it doesn't have to. You don't have to look for this big motion. Same thing. A lot of you guys, when you're doing like hip extension, things like that, you're getting upset because you're getting 12 degrees, 15 degrees, whatever it may be. It doesn't need to be this big, huge excursion. All right, go ahead, bud. I'm getting 44. So what's my excursion? 2 degrees. All right. So 2 centimeters. All right. So 2 centimeters, 10 centimeters. No norms. You're just going to go for it. The key here, guys, is looking for that compensation during extension. You want to make sure they don't throw themselves forward. They're not, the goal here is not to be, lying on their ligaments. All right. Lateral flexion, guys. Again, he's going to face to back. All right. What we're going to do is we're going to go from the fingertips. So we'll pick one fingertip and stay with it. All right. So I think we're going to go with the middle fingertip. Our first measurement is going to be fingertip to the lateral malleolus. Find that point, stay with that exact point, all right? The patient's going to lean as far as you can to the one side without compensating, okay? And then we're going to remeasure, all right? Again, we're measuring for excursion. We get 54. Then we have this side bend, all right, to the left. You guys, you want to look for a big compensation. We don't want them to literally. As far as compensating, guys, I'm not looking for him to throw his hip or hip check anybody. We don't need this. All right. So then once we have him side bend and have him hold that position for a second, we'll probably be there already. All right? And remeasure. get 44. What did we get the first time? 54. So our excursion is 10 centimeters. All right, and again, no norms. Make sure it's in centimeters. Okay. The big thing, looking for compensation, there's things of that nature. 2 MMTs for the abs. All right. There's no MMT for the cervical spine. All right. If we weren't doing overpressure, we're not doing manual muscle testing. First thing we're going to do is lumbar flexion, testing for the upper abs. We're going to test for upper abs and lower abs. All right. So you're going to have your patient lying flat on the table. And this MMT is a little unique, okay? There's a lot more for you guys to remember, and you're really not blocking him or resisting a patient at all. Right, you're going to have him lie flat, hands on his side, knees bent to about 45 degrees. All right. Now, remember, your instructions are always the key. All right. But for the purpose of this, we're going to go through what trace will be, what poor will be, what fair will be, what good will be, and what normal will be. So basically, what you're trying to have this young man do is trying to have him use his upper abs, get an abdominal contraction. So for a trace, you'd be asking him to lift his neck off the table, all right? You probably would not feel much, all right? But for trace, like we know, we always have to feel and palpate. So you really feel, kind of getting right below those ribs, all right? And you're feeling to see if you feel a contraction. Right? For the purpose of the lab, be directly on the muscle, okay? Because if it's the winter time, there's 3 layers of clothing, you might not feel anything. There might be a very slight hint of something, which could be a trace, which could be a big difference for you. For a pour, same exact thing. Hands are in the same place. This time his head is actually going to come off. Right, just like so. 1 time. That's a 2 or a pour. For a fair, this time he's actually going to come off a little tiny bit, so the arms will slide forward a little bit. Inferior border of the scap comes off. All right. For a 5, he's going to fold his hands across his chest. Same exact thing. Inferior border comes off. And for a 5, he's going to put his hands behind his head. All right. You can either put the hands behind the head, but make sure that they're not pulling on their cervical spine. A lot of people like to put their hands right at the side of their ears. Okay. Same exact thing. Goes to come up. Inferior border comes off. Pretty easy, right? A lot harder for patients if they have a lot of issues. Okay.
So what's your instruction if you're doing a trace to this patient? What are you going to ask this patient to do?
Try to raise your shoulders off the table?
Yeah, you're still going with what you want. You wouldn't then just say, bring the head up, because we're still trying to get everything we can out of the person. So hands are at your side. Please bring your head up and try to get your shoulders off the table. Try your best. But it's what you're expecting to see that's important. You need to ask for what we're looking for, but you need to know that if the head comes up, well, now we're at a trace. Or if the head barely moves up, well, now I got to palpate and see that we're at a trace. So when you get the card, it's going to say trace, but that doesn't mean that you then say to the patient, can you please just bring your head off the table? Right? You're still going with the correct instruction. Does that make sense?
And then for lumbar flexion for the lower abs, all right? A lot of you guys do outpatient. We've talked about it. As far as lower abs, what you're going to have the patient do is you're going to have them try to do a pelvic tilt. Okay? Pelvic tilt is one of the most important things to teach a patient. Also, one of the most important things that is mistaught early on. So a lot of times with patients, this is something you're actually going to put your hands on them. Your instructions to them are going to be, pretend that there's either a piece of paper, a hand, something below their low back. They're going to try to flatten your low back by going into a posterior pelvic tilt. This doesn't work with like 90% of patients. Take your hand, put your hands on the patient, bring the patient into a posterior pelvic tilt. Okay? Your instructions to the patient are going to be to actually try to do this, even for a trace. But with a trace, they're going to try to do it. Nothing's going to actually happen. You're going to be feeling right above the pubis and seeing if you feel any type of contraction at all. All right? If you're going for the patient trying to get a pour, that's what you're going to be seeing, or that's what your card says. They're actually going to be able to create, do 1 pelvic tilt. So they'd come back, create 1 pelvic tilt, and come off. For a 3, 4, or 5, slightly different. He's going to bring his legs up, all right? You're fine with the fold middle legs? You want them straight? Don't care? You're going to actually try to have them do a pelvic tilt again. This time the sacrum is going to come off the table a little tiny bit. So your instructions are the same thing. They're still trying to do the same pelvic tilt, but this time the sacrum comes off. Arms are at their side. They can grip onto the table. We don't want to see this motion here like that, all right? It's literally a little tiny fine-tuned motion. For a 3, he's going to do it once. For a 4, he's going to do it 4 to 6 times. And for a 5, he'll be able to do it 10 times. We won't kill him here. We won't make him do it more. All right? But it's simply just lifting the sacrum off. For this, try it on yourself. A lot of you guys aren't going to be able to do it. A lot of you are going to find how weak your lower abs really are.